Hello, everyone, and welcome to the Childcare Chatter Podcast, the show that educates on all things childcare, brought to you by Childcare Resource and Referral of Southeast Iowa. I'm your host, Malia Love, childcare consultant. Many of you may be aware that October is Safe Sleep Awareness Month, and today we have a really important topic on our hands: safe sleep in childcare. If you're a parent, educator, or anyone who works with children, this episode is a must listen. Many of you may be aware that October is Safe Sleep Awareness Month, and today we have a really important topic on our hands: safe sleep in childcare. If you're a parent, educator, or anyone who works with children, this episode is a must listen. To help us dive into the topic of safe sleep, I'm joined by Jessica Redden, one of our Southeast Iowa childcare nurse consultants. Jessica, welcome to the show. Can you tell us a little more about yourself, your background, and why you feel this is such an important topic?
Hello, thank you for having me. So my name is Jessica and I am a nurse at the Scott County Health Department. I work as a child care nurse consultant covering Scott County. I've been doing this job for almost 13 years and I've been a nurse for 25 years. Safe sleep is an important topic because it's a way to prevent infant deaths, and it's important for anyone who cares for a baby to do.
Awesome. Well, let's dive into safe sleep in childcare and what that means for childcare providers. Let's start off with the HHS regulations and what the guidelines are and recommended for infants in childcare.
The current guidelines state that infants will always be placed flat on their backs for sleep in a crib that meets current safety standards from the Consumer Product Safety Commission. The crib needs a flat, firm mattress with a tight-fitted sheet. No other items are allowed in the crib. No toys, soft objects, blankets, or loose bedding or pillows. No bed sharing or co-sleeping is allowed, and sleeping infants need to be actively supervised by sight and sound.
Thank you. So a lot of times staff come in and they're not really aware of what safe sleep practices are. So can you tell us a little bit about how childcare providers might get trained, or how directors might train their staff on safe sleep and consistent practices of safe sleep?
Sure. So childcare programs should have a safe sleep policy that all staff and parents are aware of and following. Staff should also receive training on safe sleep prior to their work with infants. For example, the essentials include a module on safe sleep and the prevention of sudden infant death syndrome.
And when we talk about safe sleep, a lot of times you'll see materials in centers and in homes that talk about the ABCs of safe sleep. Can you talk a little bit more about what those are and how they apply in childcare?
Sure. So the ABCs of safe sleep are evidence-based recommendations from the American Academy of Pediatrics. They are based on research by experts in the field of child safety and safe sleep. So the A means alone in a crib with a caregiver nearby. The B has to do with how we place the baby in the crib, flat on their back. And C is the crib itself, so in a crib with only a firm mattress and a tight-fitting sheet.
Great. And when we talk about safe sleep, we sometimes forget to include parents in that as well. So what is a couple of ways, or how best can providers support families in understanding what safe sleep is and why it's so important?
Childcare providers, with their knowledge and expertise in child safety and development, can be champions for infant safe sleep. They are in a unique position to not only provide safe sleep in their program, but share and recommend these practices with the parents and families they serve.
Thank you. So, talking about safe sleep and a safe sleep position, safe sleep environments, and supervision, what are some of the requirements that we see coming up?
So licensing requires that safe sleep space. So that's a crib or crib-like furniture, maybe a play yard. that has a firm, flat mattress covered by a tight-fitting sheet. The safe sleep space must be used according to the manufacturer's directions, including for the age and size of the child. Infants are not allowed to sleep anywhere else. That includes on a bed or sofa or in an item not designed for sleep, like a car seat, swing, or bouncy seat. The infants should always be placed flat on their backs when placing them into the crib. And then again, that active supervision by sight and sound is required.
Great. So we talk about the things that are not allowed to be in the safe sleep environment, what a safe sleep environment is, but can we talk a little bit more about swaddles, sleep sacks, pacifiers? Are these sorts of things allowed with the infant in the environment? And if so, kind of under what conditions are those allowed?
So first off, let's talk about swaddling. So that is not necessary or recommended in the child care setting. If we think that extra warmth is needed, sleep clothing like sleepers or footed pajamas or sleep sacks can be used. A sleep sack is a safe alternative to a blanket. It is sometimes called a wearable blanket. And the style without sleeves that are of a lightweight material are a good choice. It really needs to be the appropriate size for that infant too. And we can allow pacifiers to be used during sleep, but we want parent permission first. And then nothing can be attached to the pacifier. So no strings or cords or stuffed toys.
And what would you recommend a provider or childcare staff in a center do if they have a parent requesting that their infant have a blanket or a pacifier or something that's going to conflict with the safe sleep guidelines?
If a parent requests an alternate sleep position, the provider should refer back to their policy on safe sleep and explain why they cannot accommodate that request. This is probably a great time for the provider to share what they know about safe sleep and the risks of unsafe sleep, which is really an unexpected infant death. We can also remind parents that safe sleep or back sleep is a learned behavior and will take time and practice. And even though it may be hard, we really want them to stick with it and practice safe sleep for every sleep.
Okay. And for those infants that may have special medical needs or a certain condition, how do you handle safe sleep for those infants?
Infants with a medical condition that requires an alternate sleep position will need to have a signed order from the child's primary healthcare provider. The order must include the medical diagnosis. The order should also include specific instructions for how to achieve the alternate position and a beginning and ending date. And the child care provider should keep this written order in the child's file and also share it with any staff in the classroom.
So talking about keeping things in an infant's file for safe sleep, what are some of the other types of documentation that are required when it comes to infant sleep practices in homes and in centers?
So we want to see that safe sleep policy, so a written policy on file. Healthy Childcare Iowa does have a sample policy available. The healthcare provider order for any child that's prescribed an alternate sleep position. And then we'd love to see some safe sleep postings, reminders, and messages in the classroom and near a safe sleep space.
And I think that's so great that you bring up kind of those postings and those messages for visuals. Can you talk a little bit about what are some of the common mistakes you see in a childcare sleep environment and how maybe those postings can help correct that, or some other things that can maybe aid providers and staff?
Sure. So we do see kind of some common things in childcare settings that don't align with safe sleep practices. One thing I see often is sheets that don't fit the mattress. They're either too loose or too tight. So we really should follow the manufacturer's instructions for finding the right sheet for the size of mattress we have. It should be tight fitting, but not too tight that it causes the mattress to not lay flat. Another practice that I'm seeing a little more of is swaddling. So like I said before, it's no longer recommended in childcare and is considered unsafe. Infants need their arms free to move themselves as needed. There's also a risk of overheating and hip problems if the swaddle is too tight or not positioned correctly. Another concern is blankets in the crib or hanging a blanket on the side of the crib that could be pulled in by a sleeping infant or an infant that's still awake in the crib. So those loose blankets really just increase the risk of suffocation. So again, if extra warmth is needed, safe sleep clothing or a sleep sack is a safer option. And then lastly, the thing we're seeing a lot of is infants sleeping outside of the safe sleep space, like a car seat, a bouncy seat, or even in the provider's arms. When infants fall asleep outside of the crib, they need to be immediately moved to the crib and placed flat on their backs. A provider can hold an infant for soothing and comfort prior to sleep, but once the infant falls asleep, they should immediately place them in the crib. So some reminders in the classrooms, posters, handouts, even noting a child's skill level near their crib on if they can roll or if they do have a medical condition that requires another sleep position, we'd like to see that posted.
Thank you. So before we switch gears and jump into safe sleep and the month of October, can you just kind of give us some resources maybe of where providers might find these postings or additional information about safe sleep?
Sure. So a lot of the information that we're talking about today is available to them usually online. We can access a lot of the information on our Healthy Childcare Iowa website. And then I know the consultants with CCR&R have a lot of information available too.
And I know that you had mentioned that you are the nurse consultant for Scott County.
That's right.
Can you kind of let our listeners who do not live in Scott County know how they might be able to contact their childcare nurse consultant, where they might find that information at?
Sure. So we do have childcare nurse consultants available in all 99 counties. The information is really kept up to date on the Healthy Childcare Iowa website.
Thank you. So I think we're going to jump next into Safe Sleep Awareness Month. And as we mentioned earlier, that happens in October. Let's start with what really is the purpose of Safe Sleep Awareness Month?
So October is a time for caregivers, families, healthcare providers, and other community members to come together to encourage safe infant sleep and raise awareness on the ways we can reduce the risk of SIDS. So SIDS is the sudden and unexplained death of an apparently healthy infant younger than 1 year. Another term we use sometimes when an infant dies is sudden unexpected infant death. This term describes any sudden and unexpected death that occurs in infancy, whether explained or unexplained. There are several causes for this, but sleep-related deaths are often due to accidental suffocation or strangulation. Infants can suffocate when something limits their breathing, like a soft item against their face or being trapped against an object and not strong enough to push away. I know that talking about infant death is difficult and can make many uncomfortable, but many sleep-related deaths are preventable, so it's important that we share what we know.
So talking about how this is kind of an uncomfortable conversation, and it is often an uncomfortable conversation, how can childcare providers use this month to kind of raise awareness and have those conversations in maybe a more comfortable way?
So families often look to their childcare provider to learn about how to care for their infant. Sharing resources, answering questions, and addressing their concerns can help raise awareness. Staff new to childcare work may also have questions, so being a resource and support for each other is important.
So on top of resources and kind of those people that they can reach out to, what are some activities or campaigns that you've seen that have worked effectively to promote safe sleep during this time?
So like we said, lots of resources are available online and can be downloaded, printed, or ordered. So we have things from Healthy Childcare Iowa, from CCR&R, Iowa SIDS Foundation, First Candle, American Academy of Pediatrics has a great website, healthychildren.org. One activity that can be done with staff and families is called the Clear the Crib Challenge. So you set up your safe sleep space, you add items to the crib, things that aren't supposed to be there, maybe along with something that can be there, like a pacifier. You review with participants what makes a safe sleep space, and then you give them 10 seconds to clear the crib of all the items that are not allowed. Then when the 10 seconds are up, you count the number of correct items removed. It's a fun way to raise awareness and learn about safe sleep environments.
That does sound like a really fun way and an effective way to learn about safe sleep environments. Is that something that kind of the public health agencies or other organizations could maybe come in and do with providers or with center staff? And what are some of the other ways that they could also partner with public health?
Yeah, sure. I think that would be a really fun thing if you're competitive, especially to challenge your coworkers or have your consultant or nurse consultant come in and kind of lead that activity. In addition, I think we have a lot of really great social media options for promoting safe sleep. So just sharing things, posting reminders, and really just reaching out to our resources when we want to know more information.
Yeah. Speaking of resources, are there any updated statistics or research findings on infant sleep that you feel like are important or should be shared out?
Yeah, I do really think that the data is important and it helps drive the decisions we make or understand why we're asking people to follow safe sleep. So just a little background, when the American Academy of Pediatrics Back to Sleep campaign began in 1994, there was a sharp decline in the number of sleep-related infant deaths in the U.S., but beginning in 2020, the rate of sleep-related deaths has been increasing. The most recent data shows that in 2022, there were 3,700 sleep-related deaths. 1,529 were classified as SIDS, and 1,040 infant deaths were because of accidental suffocation. Studies show that in the United States, 80 to 90% of infant death cases each year included unsafe sleep practices. And the most recent data in Iowa shows that in 2020, there were 35 sleep-related infant deaths. 11% of the 35 deaths were a result of suffocation or strangulation. Most often there were pillows, blankets, and or stuffed toys reported in the infant sleep area. In Iowa, accidental suffocation and strangulation in infants from unsafe sleep conditions is the leading single cause of death from non-natural causes for all children. In 2020, 7 of the 35 infants who died were found on a nursing pillow. So nursing pillows are often U-shaped or C-shaped pillows, and they should only be used to assist in positioning an infant for feeding while being held by an alert caregiver. They should never be used to prop a baby or for tummy time. We just really don't want to see those nursing pillows in childcare anymore.
Yeah, and those sound like some pretty high statistics. This is definitely a serious topic to be touching on, so I'm glad we were able to speak today. We talked about resources a little bit earlier in the classrooms and what we could do for providers and staff. What are some resources, like posters, handouts, or videos that might be really good to share with families during this awareness month?
Yeah, so there's a lot of things out there, but I think the most important thing to remember is to look for images that show safe sleep and use those only when interacting with families and staff.
How often should we be including safe sleep education into our daily routines or curriculum during October?
Well, I think safe sleep is something that is practiced every day there is an infant in care. In addition to the ways we ensure we have a safe sleep space, there are other things we can do to provide a safe sleep environment and reduce the risk of SIDS. So we want to avoid overheating by ventilating with fresh air and keeping the room temperature comfortable for a lightly clothed adult. We're going to monitor the baby's temperature by feeling their core, not their hands or feet, and watch for signs of overheating like red cheeks or rapid breathing. We will also want to keep cribs away from other hazards like window blinds or electrical outlets. We're going to post no smoking signs to remind families that childcare is a smoke-free facility. We'll practice tummy time with infants, encourage breastfeeding, and encourage families to keep their infants up to date on immunizations.
Thank you, Jessica. And so talking about some activities, we talked about a couple that you could do with childcare providers, but what role do parents play in supporting Safe Sleep Month and activities at childcare?
Sure, so we want parents to follow safe sleep guidelines at home too and share the recommendations with everyone who cares for their baby.
Have you seen any successful outreach efforts that helped communities adopt safer sleep practices?
I really think that successful outreach happens when everyone a parent or family interacts with is sharing the same message. From prenatal visits to well-child checkups, everyone who works with babies and their families has the opportunity to share the safe sleep message and answer questions.
What would you say is maybe one simple, low-cost thing every provider can do to promote safe sleep this October?
So I have two things, not just one.
We love it. Okay.
I really want them to have a safe sleep policy and follow it. And then I really want to see tummy time happening in childcare.
Great. Before we end our podcast, can you maybe touch a little bit on what is tummy time?
Sure. So tummy time is an activity that the adult caregiver does with the infant. It's really any time you carry, position, or play with the baby while they're on their tummy. It's important for healthy brain and physical development. It really helps them just build strong muscles. So we want to do this with the babies while they are awake and while we can directly supervise them. So we place the infant on a safe surface like a lightweight blanket, and we just play with them on the floor. Toys, interactions, mirrors, songs. It's just a really great way to bond with the baby.
And can resources around kind of tummy time and that safe sleep policy, can those also be found on Healthy Childcare Iowa?
Yes, that's correct. There's a great handout there too.
Great. Well, thank you so much, Jessica, for joining us today and touching on such a great topic. Thank you to all of our listeners for another episode of Childcare Chatter. We are super grateful for your curiosity about safe sleep and childcare. Remember that October is Safe Sleep Awareness Month. We encourage each of you to share one tip you have learned from this podcast with a parent, friend, or family member. You never know, it might just save a life. Don't miss out. Tune in next month for another exciting episode of Childcare Chatter Podcast, brought to you by your pals at Childcare Resource and Referral of Southeast Iowa.